Lichen sclerosis is a chronic progressive inflammatory skin disorder, most commonly affecting the anal genital area, particularly in postmenopausal women, though it can also occur in prepubertal girls and rarely in men. The exact cause is unknown, but it is thought to have an autoimmune component. Women are affected much more often than men, with a 10:1 ratio. Clinically, patients usually present with intense pruritus, often worse at night, along with visible skin changes. The hallmark findings is thin white, parchment-like atrophic plaques, which may appear wrinkled and fragile. The affected skin is prone to bruising, fissures, and erosions, and the condition frequently involves both the vulva and the perianal area, in a characteristic figure of 8 or hourglass distribution. Dyspareunia and dysuria may occur due to scarring and narrowing of the vaginal introitus. In prepubertal girls, the findings can sometimes be mistaken for sexual abuse because of the bruising and tears. Diagnosis is primarily clinical, based on these characteristic findings. A skin biopsy is recommended if the lesions appear atypical, fail to respond to therapy, or raise suspicion for vulvar squamous cell carcinoma, for which lichen sclerosis is a known risk factor. The differential diagnoses to consider include lichen planus, atrophic vulvovaginitis, candidiasis, psoriasis, and vulvar intraepithelial neoplasia. The mainstay of treatment is a high-potency topical corticosteroid, most commonly clobetasol, 0.05% ointment, applied daily for 6 to 12 weeks, and then taper to a maintenance regimen. Adjunctive measures include using emollients to protect skin barrier, avoid tight clothing and irritants, and treating any secondary infections as needed. Patients should be monitored regularly, at least annually, because of the risk of progression to vulvar squamous cell carcinoma, which occurs in about 4 to 6% of patients. It is important to educate patients about the chronic nature of lichen sclerosis and the need for ongoing management. Patients should understand the importance of regular follow-up visits to monitor for malignant transformation, and they should avoid trauma or friction to the affected area to minimize flare-ups. Prepubertal girls often experience spontaneous remission at puberty. For the boards, remember that lichen sclerosis presents as atrophic white plaques with intense itching, responds to high-potency topical steroids, and carries an increased risk of vulvar squamous cell carcinoma. Key features to remember include pruritus, fragile skin, scarring, and figure 8 distribution, with a chronic course requiring lifelong surveillance and management.